This week's Ask Dr. Durie comes from a patient with light chain only myeloma. And this patient asks, it seems like patients with light chain myeloma are more afraid about the disease and are actually even afraid to ask their doctor what is the outcome because they're expecting that the answer will be that the outcome is poor. The question is this correct? And the answer is a decisive no. I think that patients with light chain only myeloma should be not afraid in this way. Patients with light chain only myeloma are the patients who have production of just light chains, the kappa or the lambda light chains. These are patients who do not have the full IgG kappa or lambda or IgA kappa or lambda in the blood. These patients can have some light chains in the blood, but mostly these lighter or smaller chains pass into the urine. And so, since these light chains and increased amounts of protein appear in the urine versus the blood, there can be a delayed diagnosis. And so, this can be a point of concern. And in the past, there was an issue with perhaps some later diagnosis of patients with light chain only myeloma versus patients with IgG or IgA myeloma. However, with the availability of the Freelte test, which measures the light chains in the blood, we do have the ability for early diagnosis of light chain only myeloma, similar to what we have for IgG and IgA myeloma. And so that difficulty with early diagnosis is much less. But the most important thing to emphasize for patients with light chain only myeloma is that what we call the underlying biology of the disease is very similar to the biology for IgG and IgA myeloma. The sensitivity to the drugs that we have currently available is very, very similar. And so there is not a poorer outcome for light chain only myeloma patients related to that versus IgG or IgA myeloma. The same risk factors apply as they do throughout the other types of disease. And so the typical chromosome factors, such as the 17p minus deletion, which is in the FISH testing, or the 414 or the 1q plus, the traditional chromosome abnormalities that are linked to a poorer risk apply in light chain patients as well as other types of myeloma. And so, bottom line, patients with light chain myeloma should not be more afraid. They should really be very anxious to talk to their doctors and seek out the reassurance of the information that I've just summarized. There is one important point, however, which is that since the light chains are in the urine, the monitoring is a little bit more difficult, and this is important to discuss with the doctor, who may need to rely on other kinds of testing to have the best assessment of response and disease monitoring. Some imaging, such as PET-CT scanning, might be required to have accurate assessment of the response and the disease status. So please don't worry in some extra fashion just because it's a light chain only type of myeloma.